The femur bone, also called thigh bone, is longest, strongest, and heaviest bone in the body. Femur bone superiorly is articulate with the pelvis at hip joint, and inferiorly is articulate with the tibia and fibula at the knee joint. Anatomically, it consists from three parts: proximal, shaft, and distal. Proximal femur. Proximal femur consists from head of femur and neck of femur. Head of femur, midpoint of its called vulvar cavities. These cavities the ligamentum teres entered in. The other consists of head of femur is greater trochanter, and the line connect both, called intratrochanteric line, from this side. From other side, the line called intratrochanteric crest. And also on this side we have quadrate tubercle. Femoral shaft, it's a slight middle slant to improve stability. We have three main lines: pecten line that near to pectineus muscle, and the clotted tuberosity that touch with the gluteus muscle, and finally linea aspera that connect with most of the muscle and blood supply. The section part that's connected with the distal femur called the popliteal fossa. On its sides we have middle and lateral supercondyle ridges. In the middle side we have adductor tubercle. Distal femur. First thing, we have middle and lateral condyles that connects with the tibia in the knee joint. Second part, we have middle and lateral epicondyle and trochlear groove. Finally, we have intercondylar fossa. Femur fractures in newborns are unusual, but can occur, for example, in babies born with the skeletal dysplasia, such as osteogenesis imperfecta, also known as brittle bone disease, or sometimes following a very difficult delivery. Fracture in these very young children and infants are usually treated by placing the child in pelvic harness, a cloth brace that helps hold the thigh in the proper position while it heals. At this young age, children's bones heal very rapidly, usually by 3 to 4 weeks. That who says David Scare, a situated orthopedic surgeon at hospital for special surgery. Types of a fracture. We have three types that happen to the femur cause the fracture. First one is the hip fracture. The hip joint is made up the connection of the pelvis to the femur. When the femur is broken at the top part, this is considered a hip fracture. Second fracture is femoral shaft fracture. These occur in the middle of the femur where the walls of the bone are thick. This information sheet refers to this type of fracture. The last fracture happened to the femur is distal femur knee fracture. These femur fractures occur near the knee and are often near through the growth plate. Technical factors. Minimum SID we use 40 inches. IR size and placement determined by size of body part to be radiographed crosswise. A grid not necessary for infant and small children. Shortest exposure time possible. For the analog, we use 60 to 70 kilovolt, and in digital system we use 65 to 75 kilovolt. position, the AP and lateral position. Embolization techniques should be used when necessary. Patient is supine with IR. Patient centered to the affected limb or placed diagonally for bilateral limbs if needed, to include entire limbs from hips to feet. For bilateral limbs, abduct both limbs into frog-leg position. The C-arm is perpendicular to mid-area of limbs. The evaluation criteria in AP, lateral and middle epicondyle of distal femur appear symmetric and in profile. Tibia and fibula appear alongside each other with a minimal overlap. In lateral, middle and lateral condyles or epicondyles of distal femur are superimposed. Tibia and fibula appear mostly superimposed.